Despite the drop in COVID-19 cases over the past week, the Director-General of Health says they will continue to rise. Today, the numbers jumped to 647 in total after 58 new confirmed and probable cases were announced. This includes a second nurse at Queenstown's Lakes District Hospital. The Director-General of Health, Ashley Bloomfield, says even though there are fewer numbers confirmed, New Zealand is not out of the woods yet.
I have no sense that this is a drop overall, and our expectation is that the number of cases will continue to increase. The number of cases may reflect that there were lower numbers of tests done on Sunday in particular, and that's what we're seeing come through. Our full expectation is that the number of cases will continue to increase over the coming 7 to 10 days.
Ashley Bloomfield says couriers are also less frequent on Sunday, which could have contributed to the lower numbers. He says if level 4 is adhered to, the number of new cases each day should fall after that 7 to 10 day period. But in the meantime, hospitals are still seeing cases in general and ICU wards.
There are 14 people in hospital currently with COVID-19 in a range of hospitals across the country, the details of which will be on our website. I can tell you that 2 people are in intensive care, both are stable.
But Dr Bloomfield says modelling released today paints a grim picture on what COVID-19 could do if the country wasn't in lockdown.
They paint a sobering picture of what the impact of COVID-19 would be in Aotearoa, New Zealand, if we were not taking a very decisive and strict approach to our response. That is the implementation of the Alert Level 4 measures. So without the actions currently being taken, the uncontrolled spread of COVID-19 would clearly exact a high price on New Zealand in terms of its impact on our healthcare system, on our healthcare workers, and of course, in a large number of deaths.
Ashley Bloomfield says the case definition for COVID-19 has been revised and widened to help find cases of community transmission. The technical advisory group met and has made plans to change the criteria people need to meet to be tested. Dr Bloomfield says they are looking to expand the testing so that an overseas travel history or contact with a confirmed case would not be the only requirements.
I specifically asked them to look at the definition, given that we now have evidence of some community transmission. The key thing I wanted them to look at is whether we decouple the symptoms that form part of the definition from the requirement to have a travel history or to have been a close contact of a confirmed or probable case.
Ashley Bloomfield says people who didn't meet all the criteria are already able to be tested if clinical judgment thinks it's necessary. And while Civil Defence is mostly happy with our behaviour, Director Sarah Stewart-Black says we could be doing more. She says people need to stop congregating in parks and beaches, and parents need to stop taking their children to playgrounds. She says the Kiwi tradition of passing something over the fence to the neighbour is also a no-no, as is flushing wet wipes.
Unfortunately, disposing of wet wipes down the toilet leads to extra blockages in the sewer network, and this includes flushable wet wipes. So the bottom line is, if you'll beg my forgiveness, please always put wet wipes in the rubbish and not in the toilet.
The message is still the same. The better people adhere to level 4 lockdown and physical distancing, the better off New Zealand will be.